But other than that, good. Yeah. Yeah.
No.
Okay, guys, I believe we're going to start. Welcome to the June 5th, 2026 Children's Cabinet meeting. We are in person, the majority or a quorum of us. Welcome, welcome. As we begin today's meeting, I want to thank each of you for your commitment to Kansas children and families. The work that we do together may improve policies, budgets, programs, but at its heart, it is about children. The children of Kansas' futures are shaped by the decisions we make. There's a quote often attributed to Frederick Douglass. It's easier to build strong children than to repair broken adults. And as Will Rogers more succinctly put it, letting the cat out of the bag is a whole lot easier than putting it back in. Though they say it differently, both remind us of the same truth. Prevention is better than repair. When we invest in children early through strong families, quality education, good health, and supportive communities, we create opportunities that can last a lifetime. When those opportunities are missed, the challenges that follow are often much more difficult and costly to address, which is why the work we do here matters. We are not simply funding programs. We are helping build the foundation on which children in Kansas can thrive. So I want to thank each and every one of you for your service and your willingness to do this important work together. So welcome today. I look forward to a productive and meaningful meeting. How glorious it is to be together in person and see all of your beautiful faces. So we have Dave Younger, and his daughter has a special day today, a wedding, and Dave is joining us remotely. And I'm hearing that he's on. Tabitha has a flight at 2:55, so we're going to be efficient with our time to use your time wisely. And then Tori Blue is on her way in, driving now. Is Tori on as well? Okay, fantastic. Welcome, Tori. And then Representative Weichel is en route, coming a little bit late. So that's the lay of the land. And today we welcome a new cabinet member. Lori Blake is being appointed to the Kansas Children's Cabinet by Governor Kelly. Lori brings more than 2 decades of experience in nonprofit leadership, child advocacy, public education, and community development, all the things. She currently serves as a leadership services specialist with the Kansas Association of School Boards, supporting school board members and superintendents across Kansas. Previously, Lori served nearly a decade as the executive director of Child Advocacy and Parenting Services, CAPS, leading programs that strengthen families and expand services for children across multiple counties. Lori has a long history of civic community involvement, and her career reflects a deep commitment to servant leadership and helping children and families thrive, and communities too. She and her husband have raised 3 children in Assyria. I'm getting there. I'm like, how do I not know this? Near Salina? Yeah, I just always thought you were from Salina, where they continue to live and serve their community in a variety of ways. We are grateful to Governor Kelly for her appointment, and we look forward to the perspective and experience that Lori brings to the cabinet. Lori, do you want to tell us anything about yourself?
Well, thank you so much. It is my deep pleasure and honor to be at this table with you all. I worked for CAPS the first time when this fund was developed. And so I have been a part of the Kansas Children's Cabinet following the works and advocating for children through its entirety. And so I could not have been more pleased and humbled when I got the call a few weeks ago to consider this opportunity. So I look forward to working and continuing to advocate for children and families across this great state.
We welcome you. We're glad to have you. So the first item of business is the approval of the April meeting minutes. You all received this earlier, thanks to Dioga. Do we have any corrections or amendments? Hearing none, I would entertain a motion to approve the minutes.
So moved.
I have a motion. Do I have a second? And a second. Let's just, everybody in favor say aye. Aye. Any opposed? Okay, the minutes are approved. The next item is the Children's Initiative Fund Ability Report. Owen Cox from the Center for Public Partnerships and Research at the University of Kansas Center for Public Partnerships and Research is going to present the Children's Initiative. I repeated this, accountability fund accountability report. We're going to allow Owen to get all the way through his report. Every slide is numbered. So if you have a question, just take a note of the number of the slide, and we will at the end have a Q&A because it's a pretty deep dive, isn't it, Owen?
It's a pretty deep dive, yes.
Okay, we look forward to hearing from you. Did we have a question at all? I thought I heard, okay. I have a ruptured eardrum, so guys, like flag me if I missed something, okay? Owen, thank you. Look forward to
Absolutely.
it.
And thank you to the board for having me back again this year. Some of you probably recognize me from previous years, but I am new to some of you as well. I will try to keep pace on this to keep it up. There will be plenty of time for questions at the end, but do know that I'm certainly happy to answer those. And I think we can just go ahead and get started. And we start with the hardest slide for me to actually explain here, and that is the timeline of why we are here right now and what we're going to be looking at, and then also a little bit about what you all will be discussing after this presentation. So the accountability process itself takes place, or the presentation of it takes place in the June's cabinet meeting, essentially because it needs to align with the legislative budget process. I know that process just finished recently for fiscal year 27. So when we talk about recommendations, that's going to be recommendations around fiscal year 2028. The reason that we do that is because state agencies need to come up with their projected budgets to give to the legislator starting now, essentially. And so we will be talking about recommendations around budget year 2028. However, I also recognize that we are still currently in budget year 26. And so all of the grantees are still working on their projects, their programs, and numbers are still coming in. So when you see numbers represented on the slides I'm going to share, those are actually going to be fiscal year 2025 numbers. So a little bit look in the past. We're about a year past that now. Those numbers will be updated in the Children's Cabinet Annual Report released in December. So you'll get another look at the 2026 numbers once they are all in here. And so we're covering a lot of ground. We're going from 2025 all the way to 2028 at the end of this. So please do know if you have any questions about that. I'm happy to answer those as I can. All right. This is just a slide here about the components of what we ask for from grantees. So we collect reports from all of the CIF-funded grantees. We ask for any reports that they compile for their own internal purposes or outside funding agencies that they might have besides the Children's Cabinet. And so we get a lot of different federal reports, internal evaluation reports, and we try to compile all of those to really give us our first look at how the programs are doing, and ideally to streamline the need for additional reporting from them. We're trying to make this as easy a process, but also a thorough process when it comes to looking at the impacts of these programs. Any information you'll see on the funding for 2025 on the slides does come from the actual expenditure totals from the Kansas governor's budget that was released for fiscal year 27. We also have an accountability process survey where we get additional details about their budget, service provision, and other information that we might not get from their standard reports. And then finally, I think I say this every year, but my favorite part is the program interviews, where we have each and every one of the CIF grantees come in, or virtually as they usually happen, and we just talk with them about their program, understand a little bit more about what's new, what's happening, and then just get a better understanding of the work that they do. So we really enjoy those. Okay, so next couple slides here are going to be just some depictions of the funds for the Children's Initiative Fund from 2025. So we want to move to that. We have here a depiction of the funding by the agency. So this is where the CIF funds went, which Kansas State Department or agency received those funds. You can see the largest total there stayed within the Children's Cabinet and Trust Fund. This depiction is obviously changing as the Office of Early Childhood is opening, and so that'll probably be something we discuss a little bit later in our talks here today. I did note 3 particular projects that were one-time funds that happened in 2025. So they're kind of special cases that happened and were not sort of repeat funding streams from the Children's Initiative Fund. So again, here's by state agency. If we go to the next slide, you'll see this is broken down here by primary population. And so you can see a large part of the funds go to that prenatal to age 5 group, with a few others in there. And that provider section there, you'll note that actually the 3 one-time funding projects were included in that particular category. All right. So now we're going to get to the actual funded programs themselves, and I will probably move through these pretty quickly. So as was noted, if you want to have questions about specific programs, please note the number, and we can come back to those slides at the end. All right, the first one is the Child Care Assistance Program. This is a program for families who are living at or below 85% of the state median income. This program provides subsidies for childcare, and that is for individuals who are either employed, continuing their education, and sometimes to fulfill an emergency need. Idea here is to both promote school readiness, but also really to provide that support to continued families while they are working or increasing their financial stability. And next, we can talk a little bit about some of the impacts we see from that program. What we have seen is that child care assistance is related to higher wages and longer retention for those families. And in fact, from child care assistance program here in Kansas, they saw that 70.4% of families that were receiving child care assistance saw their earnings either increase or would at least remain the same over the course of their next review period. I will say that some of the things that have been happening, they have been aligning their system to meet the new federal requirements that have been put in place. So there's been a lot of work toward that. All right. Next, I believe we have Dolly Parton's Imagination Library of Kansas, a favorite program of many people. Dolly Parton's Imagination Library really focuses on providing free books to children from birth to their 5th birthday. I did want to note here, this is kind of a point in time count here. So that number that you see of total children enrolled, that was as of June 30th, 2026. So that is a sort of a point in time count for that particular year. Moving on to some of the impacts that we've seen from Dolly Parton's Imagination Library, you can see the newly enrolled children during 2025 there. We also saw that statewide 43% of age-eligible children are participating in the Imagination Library of Kansas. I always like to say just how many books are distributed because it's a large number, right? We have almost 589,000 books being distributed by this program to kids across Kansas, which I think is fantastic. Did also want to note that during this past year, the 501(c) status was established, which now enables fundraising for the program, and we could hopefully be able to use those funds to increase the impact across the state. All right, the Early Childhood Block Grant. I will give just a quick overview of the Early Childhood Block Grant because you're going to get a much more in-depth presentation specifically on this program at the next Children's Cabinet meeting. Early Childhood Block Grant, or ECBG, as we call it, really focuses on providing high-quality early childhood care and education services for children from birth up to kindergarten, and also provide some services to those families. Services can include childcare, pre-K, classroom supports, mental and behavioral health services for children, home visiting, case management, and parent education. So you can see there's quite a bit of services that are utilizing, or that can utilize Early Childhood Block Grant. A couple of the highlights from last year's ECBG report. We saw that 81% of classrooms were observed to be high quality. That was noted that was the highest rate in 10 years, so that was really great to see. We also saw 88% of parents enrolled in services engaged in positive parenting, also the highest rate in the 10-year look back. So that was another great one that we saw. Again, we'll have a more in-depth presentation next week, but also I just wanted to highlight that, working with grantees to concentrate, that the staff have been working with grantees to concentrate ACBG funds on fewer program types to reduce some of the reporting burdens and also improve their ability to comply with the evaluation. All right. Next one here is the Kansas Early Childhood Developmental Services. This group provides early intervention services to children birth to age 3 in their natural environments who have a disability or developmental delay. If we want to move forward here, I'll talk a little bit about their impacts. As you can see, they have quite high performing impacts when it comes to a couple of these federally required reporting pieces. So essentially, nearly 100% of children with individualized or IFSP demonstrated improvement in positive life skills and/or had skills comparable to their same age peers. 99.9% of children with an IFSP demonstrated improved use of appropriate behaviors to meet the needs and had skills comparable to same age peers. So really high levels of performance on those particular one. I do also like to highlight that they are continuing to have a memorandum of agreement and partnering and collaborating with the Kansas School for the Blind, as well as the Kansas School for the Deaf. And they're also looking to extend the reach of those programs. This year we had a nice conversation around some of the feedback families have given, and it led this year to the creation of a program called Moms Mingle, which is really to bring folks together who use this program within communities as a sort of like a support and connection source. All right. Moving on to Kansas Preschool Pilot. This program funds schools, school districts, and community partners to set up high-quality preschool programs for children ages 3 to 5. Using evidence-based curriculum, I should say. And school districts can use grants to partner with community preschools, private preschools, or other community agencies to provide these preschool services. All right. Some of the impacts we've seen for preschoolers enrolled in the program is that 95% of these children show improvement in literacy, and 96% show improvement in mathematics from the beginning of the program to its end. There will be some changes coming up, and that is that eligibility will now be, need to have 100% of their students needing to meet at least one of the eligibility criteria listed on the slide there. Okay. Kids Network, once again, another program receiving CIF funds. It's Kids Network. It offers support services to any individuals who have been impacted by the tragedy of infant death. It also provides community education, professional training, and research to all meant to strengthen the statewide infrastructure around the prevention of infant death. All right. They are busy. They had 497 safe sleep events across 88 Kansas counties when we talked with them about their fiscal year 25 performance. They also have currently 179 certified safe sleep instructors and 7 safe sleep start clinics and 8 hospitals that maintain safe sleep certification. I should note that they actually have trained providers in states outside of Kansas. They're actually getting quite a national reach for their program. And then the one thing I definitely wanted to highlight is that bottom bullet point there, that this program was elevated from a promising practice to a best practice by AMCHIP this year, which is a pretty big deal. And they also received an Innovation Hub Practice Development Award at that moment. So good job for the Kids Network. All right. Maternal health child home visiting is a strengths-based home visiting model open to Kansas families with or expecting infants in their service areas. I should say it is a universal approach, so there is not eligibility criteria other than expecting or having a child within the age range. So a universal program for families who are in the service areas that are available, where there are providers. Okay. Let's see, in fiscal year 2025, 8,624 home visits were completed, which is actually a continuation of an upward trend we've seen over the past 3 years for this program. So they continue to reach and provide more home visits for families that they're working with. Couple stats there on the initiation of prenatal care in the first trimester. So that's one of their goals, is if they can work with individuals that are prenatal to make sure that they're getting the care that they need. And then also that the infants that are seen by these home visitors do indeed make it to their medical appointments or have a medical home at least. That's great. Yeah, Parents as Teachers. So Parents as Teachers is another home visiting program here in the state of Kansas. It's an evidence-based model designed to give parents the tools needed to support healthy child development. Specializes in early childhood screenings and helps identify areas of concern, implement interventions, and also refer families to other additional needed resources. So Parents as Teachers, again, another one of our home visiting projects here in Kansas. Some of the impacts, you can see they have, again, a lot of home visits were completed, so over 53,000 completed. It's a program that sees a high retention rate for the families that are engaged with it. As you see, we said there's an emphasis on looking for screenings and making referrals. During fiscal year 2025, they saw 2,352 potential developmental delays and concerns during their screening process. I do want to also note here, I don't have their names in front of me, but that there were 2 Kansas professionals that received the actual Parent Educator of the Year awards nationally, which was fantastic. And then there was one that was recognized as Kansas Educator of the Year as well. So that program is really doing a good job of bringing up home visiting professionals in the state, doing great training, and obviously the work is appreciated. Okay, Tobacco Use Prevention Program. This is a program that uses evidence-based strategies as well as community partnerships to increase the public's awareness of the negative health impacts of tobacco. And it also operates the Kansas Quit Line. So that's the statewide quit line for folks who are interested in quitting their tobacco use. The program also works at the community level to promote policy change around tobacco products as well. Right. So here's some of the stats. One of the things that I was keyed in on this year is how much they're expanding their youth programming. And so you'll see there that 26.5% increase in the number of youth enrolled in My Life, My Quit between fiscal year 25 as compared with fiscal year 24. So that's a program they continue to put an emphasis on. A couple changes to how they host their regional events, which they think they've seen that is adding additional participants to that. And they've also been moving to an incentive-based professional development to be more accessible and have more evergreen resources for training school staff and new materials that are developed and to be released in the coming year. Early childhood infrastructure. Okay, this is a line item here that is used to support the long-term vision of the All In for Kansas Kids strategic plan. It set aside some dedicated funds to support early childhood systems level resources that'll help the cabinet fulfill its role as the connector and its statutory responsibilities as coordinating the entity for the early child as the coordinating entity for the early childhood system in Kansas. I want to note here some of the things that were that those funds were used for, and I also want to note that that fund was used for some administration costs for the cabinet, but it was less than 1% of the funds that were granted to that particular program. Okay. Take a deep breath here. We're going to get to those year funded programs. We'll talk a little bit about them. So we have the 3 that were funded in fiscal year 2025, and then there's 1 that was funded just this current fiscal year for 26, and we'll talk about that one last. So CAPE, also otherwise known as a workforce registry. This program is meant to, excuse me, this is a program is a registry for the early childhood workforce aimed at connecting professionals with employers. As well as thinking through reading, recording professional developments, so activities are recorded within the system, and providing resources and support to allow people to develop professionally as well. All right. Oh, sorry. I was going to get onto a couple of impacts because it's an interesting problem. Just launched in 2025, right? And so it already has users in all 105 Kansas counties. There are already 16,000 profiles entered into the system, and of those, there are over 7,000, which are educator or direct care professionals. And you can see the large amount of course offerings there. One of the interesting things about this is that these numbers continue to go up. I talked with them a month ago. I guarantee those numbers are quite a bit higher than they were even at that moment. All right. Health and safety grants, another single year funded program. This was a program aimed to assist child care providers by achieving regulatory compliance by providing some funds for when they need to alleviate cost burdens where some of the regulatory barriers have come up. Includes costs related to the annual inspection, complaints, and self-identified issues. One of the nice things about this is as the grantees have gone through the process, they've reported learning more about the regulatory process itself and some of the things that are needed when it comes to having a child care facility. As you can see, they received 359 applications, able to approve 215 of those, 81% being those home providers and 19% being center-based providers. I also would like to note that they did fully expend the money that was granted to them via the CIF fund, and all of that funding went directly to the providers. They were able to cover the administrative costs on their own for this one. All right, Northwest Kansas public-private partnership. This was an interesting one. It kind of, you'll see as we talk through it, basically about establishing an endowment. So Northwest Kansas Private Partnership is an endowment established by the Dane G. Hansen Foundation. It is held and invested and administered by the Greater Northwest Kansas Community Foundation. And the goal of this is to sustain child care facilities, allow for higher wages, and allow more Kansans to enter the workforce by accessing reliable child care. It has a particular focus on providing care for infants and toddlers, and obviously you can kind of see their 26 county catchment area where folks can apply for this. Should note that it was initially funded by $5 million. That was what happened in 2025 from the CIF. The CIF was able to give $5 million, and then there's a continuing commitment of $1 million per year from the Dane G. Hansen Foundation. And then also the Patterson Family Foundation has graciously agreed to contribute $1 million. So that ends up being basically $11.1 million in total committed funds to the endowment. And they're already in the process of grant making. They just finished up a grant making session here recently in April, and for 2026, they are projected to have $390,000+ available to put out in grants. Okay. So here's the program from 2026. So most of those grantees that we've been talking about were from 2025, but this is a new program that was single year funded in 2026. So we also wanted to talk with them this year during the accountability process. And this is the Dodge City Accelerator Project. And so this is a project that really began as a part of a coalition that was formed in 2019. And that was because the community came together and saw that there was a lack of employees, due to a local employers experience a lack of workforce workforce due because of insufficient childcare. And so they put together a community-wide effort to address this. In 2024, they were officially became a 501c3 as well. And that board allowed them to bring together various components of the community to really start tackling this project. The coalition has secured over $6 million in funding. Again, here's another one backed by a large commitment from Cargill for the creation of a child care facility. But other additional funds were added to this as well. So we just recently said the Kansas Children Initiative Fund chipped in money. The State General Fund also provided money for this particular project. The Patterson Foundation again, and Hilmar Cheese, which is a local has a local facility there, and also a building that had been donated by the local development. So a lot of different community partners, public and private, coming together to try and get more childcare available to really sort of tackle a need within the community. They had a groundbreaking just recently in 2026, and construction completion is expected to be done in 2027 on that particular project. Okay, so those are all the programs from 2025 and one from 2026, which we'll talk with them again for next year's accountability process. But I think the next thing we want to do is just talk about a few key takeaways that we saw when we went through this process. The first one is that there continues to be workforce shortages and staff turnover within these programs. That's both at the local level and sometimes also at the state level. When it comes to sort of local providers, what we are still seeing is you can make more money in other professions oftentimes. And so they have to deal with that when they are talking with the staff and understanding how that might affect turnover. There's also still funding limitations and fiscal constraints, something that we might talk about here in a while. A lot of these programs have and continue to kind of have flat funding from year to year, so it makes any sort of expansion difficult. And as costs might go up, they're still with the same amount of money to provide a similar amount of services. And then we also see economic and logistical hurdles for families. This is reported up through the programs to us during the accountability process. It's, things can be expensive. Childcare is an expensive thing. Other things associated with early childhood also remain expensive. And so families continue to express that. And also there's a lot of different moving parts still when it comes to early childhood. And sometimes those provide hurdles for families to be able to access the needed services. But I do want to point out, though, that while these are challenges that come up in the accountability process with these programs, these are also problems we see as national trends when it comes to early childhood. So this is not a specific Kansas problem per se, but it is something that we still continue to see here in Kansas. I do think that a lot of these programs are trying to work toward addressing these challenges. And I think some of the things that we've seen here at the state level are also working toward that, be it the Office of Early Childhood or some of the other initiatives that are taking place. But I also want to highlight some strengths because they certainly are there because these programs are doing great work. One of the things that I really appreciate is that each and every program does intentionally include family voice and community feedback in their programming. Like these are targeted to the community. The services that they provide are really meant to lift the community where it needs to be lifted and to have the programs that families have choice in and can really sort of guide what the program services are. Data-driven evaluation and quality improvement, that's probably the one that I'm excited about the most in this room. But each and every one of these programs is doing a good job when it comes to making sure that they have a accurate depiction of the work that they are doing and able to talk a little bit about their outputs and outcomes. Excited to have some more streamlined processes around that as we keep moving forward. But I do appreciate the amount of effort that they already are putting into these. And I think you've seen pretty well through the various slides that we really do see a lot of multi-sector collaborations and strategic partnerships in these programs. They are leveraging what they can within the community, bringing people together from sort of diverse sectors to make sure that they're providing the services they can. And again, with the community focus on what is needed in those particular areas. All right. I think that was my last slide. Okay. I will pause there. Before I get into questions, though, I do want to give just a moment to thank all of the grantees for their participation in this. I know we try to make it as small of an ask as possible, but it ends up not being the smallest ask for sure. In a busy time, they have to make time to meet with me. They get a lot of emails about me asking questions whenever I get their reports in, and they all are just really lovely when it comes to like responding to me and probably maybe through gritted teeth, but I can't see that via email. So I appreciate all the efforts that they do. All right, I'll pause there and see if there's any questions.
Thank you for the report, Owen. He's standing for questions. Does anyone have questions or comments? Let's start with Representative Williams. Let's just go right to left. Is that good, Laura?
Thank you. And thank you for your presentation. I tried to take it all in and it was very helpful for me to digest. When it comes to the Northwest Kansas grants, I was just curious, when it comes to that 5 million in additional funding, is that just for maintaining slots, or is it creating any new slots out in Northwest Kansas? Do you have that data?
For the Northwest Kansas Public-Private Partnership,
Correct.
I don't have data on whether new slots have been directly created by it. The 5 million goes into the endowment, and the endowment is intended to stay as the endowment. So any additional funds are what becomes the grants that are granted out to grantees. Those often are for supports around, could be needed things at the particular facility. But I do know that there's been an eye toward making sure that those grants are, while going out to those grantees, they're also understanding that it's a one-time grant and how to sustainably use those funds now and then be able to leverage them in the future. So whether or not it's created specific additional slots, I could not tell you right now.
So can I just ask a follow-up on that?
Yep.
So it just more so goes for one-time spending for it and within the childcare facilities when those grants are given out. They're one-time funds for one-time spends. Is that how they're approved?
Yes, that is how it is. Melissa, I think you've been on the group that has actually reviewed these. So
Yes.
Thank you, Owen, and thank you for the question. The fund is designed to address emergency financial needs. So we've, in years where there are fires or storms or some sort of unforeseen event, there may be, you may have insurance coverage, but have a deductible, and a childcare provider doesn't necessarily have the savings to pay that deductible. So emergency uses are entertained on a rolling basis as they come in. There's also a board that entertains quarterly grant applications, and that piece of it is designed for sustainability purposes to help bridge gaps that providers may have with their annual budget. So it's a fine balance between keeping doors open really and not becoming something that providers rely on and would need repeat grants to be able to sustain. So alongside the grant funding, then there are folks in that region who provide technical assistance, coaching, and mentoring for helping providers address business challenges and update their business plans. You see a lot of well-intentioned policies that are hurting bottom line. So I don't want to name names, but we have seen examples where a provider allows families to withdraw their children over the summer months at no cost to reserve the spots so they're still there in fall. And that's lovely in the effort to make it affordable for families, but then it becomes unaffordable and unsustainable for the childcare provider. So the grant request, there were other aspects of the grant that were funded, but that piece of it, there was coaching prescribed to be able to help them update the business plan. So it's a combination of factors. The Northwest Kansas Community Foundation has a specialist who provides that technical assistance. Dangy Hansen has had a particular focus on early childhood programming in that region. So the funding creates the endowments. The grants that are funded are based on the interest earned off the endowment. So it's a mini version of the model that was intended by the Children's Cabinet Key Fund and CIF setup.
Thank you. Thank you for the broader explanation of that.
Great question. Representative Christy Williams. Thank you. Okay, so I do appreciate the overview. It's very helpful. And of course, I've said it before, but I would love for us to shift from the dependence on institutions and shift more into families. So I don't love that we're growing our systems and our institutions. So I do have concern about that. There's ever-growing dependence on these entities that are getting grants, that they're getting them again the next year. So that's a huge concern. And I, of course, along with that, would just much prefer us to take these dollars and fund families and give them the freedom and the diversity of options rather than us pick them for them. But with that, I know we didn't go in detail about the CIF grants because we've already done that, but could you give us a breakdown? I wrote down my questions. Could you give a breakdown of the childhood funding for these grants to centers versus the homes, as well as how much each seat for each grant? So we kind of understand what are the cost differentials, and also how many or what percentage would be faith-based. So how much, so again, so how much, what percentage of those total grants are going to centers versus home-based? What's the cost per seat per provider? And how many of those are faith-based? Thank you.
I will freely admit that I do not have that data here in front of me at this point, but certainly we can endeavor to receive it. Are you interested in childcare slots for childcare facilities, or are you also interested in like home visiting providers and
Thank you. I'm interested in actually those slots and those providers for families that we talked about, the families that are 85% of the poverty line. And so we're all of these individuals that are taking part of these centers and home-based childcare services. So that's what I'm looking at. How much does it cost to provide all of these services? What's that return? What's the difference in the cost between those two? Are we neutral in the grant awards to what type of space it is? Because of course, it's just this one singular opinion. I am, as a mom of 4, now they're much older. My youngest is 21 today. So I much prefer that home-based. And so that's kind of what I'm looking for. And then I'm just going to tag on one thing, and this is, you probably don't have an answer for this, but I think about workforce. We talk about workforce over and over and over, but how many people in Kansas now are taken from the workforce to be part of this enterprise for centers? And we have criteria for how many teachers and how many staff members are needed for each child, depending on their environment. So I would think that we've got 7 to 20 plus thousand people that are no longer available for the workforce because they're put in these spaces. So when we're looking at cost benefit, I think that would also be something that we should be taking a look at. Thank you. Melissa?
Thank you, Madam Chair. What I will tell you is last year we did a pretty deep dive into our early childhood block grant slate, and for all of the providers who receive those funds, the cost for families to utilize the services is either reduced or erased. So the home visiting programs that the Early Childhood Block Grant Fund are provided at no cost to the families participating. The childcare that's provided is at a reduced rate by virtue of the funding that's being provided. The evaluation requirements that are tied to receiving these grant funds do not lend themselves to providing these for parents. Parents who are within the poverty guidelines qualify for the child care subsidy program that is federally funded and supported with $5 million worth of CIF funding as match share. So there are, you can see the numbers of children who are part of that program in households receiving the child care subsidy. So there is a program available for families. The CIF line item transfers away from cabinet direct oversight to other entities reduces our ability to really do the deep dive, the type of questions you're asking would necessitate. I do have optimism that the movement of many of these programs into one agency will begin to offer us opportunities to evaluate and do the type of closer look that you are raising, and rightfully so. We can come back with the metric on faith-based recipients because we do fund faith-based programs across the variety of different opportunities that exist. So the one-time COVID projects included a number of faith-based programs as recipients. We are excited. One of the capital projects funds is St. Benedict's Abbey, creating a campus for families. And they are, I'm not sure how close to completion, but it'll be later this calendar year that one completes, and we can bring back more statistics. But we do have grant recipients in the faith-based community. There are more than, by census, there's more than 200,000 children in this birth to 5 age range. So I'm not sure how far our whether you call it the 23 million of the early childhood block grant or the overall total of the CIF as a whole, I'm not sure how we divvy that up to the eligible families and make a meaningful contribution to their bottom line. I think offering the services and making things available in communities where there's high need is probably the most impact that we can provide for the funding that we have to offer here.
Thank you. Other questions? Dinah, sorry, Dinah. Thank you. Senator Sykes.
Thank you. So I have a question and then a comment. So on the last slide on 35, those challenges. So and this may be for Melissa or someone else. But as we change some policy on business tax credits this year, and I know some of those challenges is access, and I think making sure that we get the message out that we have expanded eligibility for those tax credits and the amount that they're able to take for that credit, and then kind of how many years. Is that part of the conversation? Are we making sure that we are getting that message out to businesses to help them partner with us more? And then I have a comment after that.
We've done our part. I think that is a question for a larger ecosystem of partners to share that news. We like to partner with economic development entities and local chambers of commerce, the state chamber, to make sure that opportunity is known. I appreciate the work done legislatively to help simplify that program and help businesses better understand how they can use that for their practices. But we have some tremendous business partners in the state who are doing wonderful work to help families.
Yes.
And then my comment, thank you, Owen, for this. I love seeing these slides and hearing this, but as I have been traveling the state since session got out, I had the opportunity to visit Erie Community Child Care Center, which was one of the grant recipients, I think, during COVID. And it's a faith-based facility, and seeing being a part of that, seeing how it has affected that community was amazing, and I wanted to stay there forever. But I also thought it was great because, it was that one-time grant, and they were being so purposeful and making sure that it is sustainable, and really looking at, how do we open a coffee shop? How do we rent our space like on the weekends to a church? And so it was really great to be in that community and see it. So I just want to encourage other members of the cabinet, as you're out and you can take advantage of these, it really warms your heart. And that was 60 slots that opened up in that community. And it was a community that was really struggling, and now seeing it starting to thrive. So I just wanted to say thank you and share that little tidbit of great news.
That is great news. Thank you. Do we have okay. Okay. A question online? Senator Blue? Okay.
Thank you. I'm so close. I was hoping that somebody would filibuster so I could be in the room to ask this question. My question is, I just want to say, I do share some of the concerns that Senator Williams or Representative Williams stated when it comes to grants. But my question is, not every grant is just open to whatever you want it for. There's certain earmarks and certain things that have to be part of why you qualify or why you don't qualify. My question is, one, could you kind of give just a brief overview? Because when we were going over the last board meeting, some of the grantees with what we were going over, they didn't qualify because they didn't hit a certain pillar or something like that. My question to deal with that though is with the one-time funds, fire protection is the biggest, and that is my other background, but fire protection is turning into be one of the biggest concerns, because if you were to buy a new building and change occupancy, then you have to have fire sprinklers in a building that's over 10,000 square feet. Could some of these grants be utilized for some of those situations? And the other thing with learning from other folks when doing this is home insurances are not allowing child care providers to work out of their home. And so that's been a struggle. And so those are just kind of, I know those are kind of high level questions, but are there things that maybe these grants can help with, or is the insurance issue turning into be maybe a regional thing or just a certain company thing? Has that been brought up to anybody else? Those kind of things. And I get the when folks are talking about well, we don't have health care. Well, neither do other sole proprietors. They have to go find it elsewhere. So I understand their concerns for home care, home daycares when they don't have that. But the homeowner's insurance is something that if you can't utilize your home and you have to go find another place, that's another expense. So there's a lot of questions right there. I just kind of curious if you could address any of them.
Thank you, Senator Blue. I appreciate you servicing the insurance issue. That is a trend that is really kind of sweeping the nation. Insurance carriers that have been really hard hit financially by the number of natural disasters that we've seen in recent years are looking for ways to address their bottom line. And one of the things that we're seeing, it's happening in Kansas. And when we first started getting news about it, there was some intensive research done to see if there were anything that we could do as a state or any existing regulations that were being broken. Basically, what I learned is that the role of the Office of the Insurance Commissioner is to enforce the regulation on the books. This is a free market issue. These are private businesses, and the insurance office reviewed the case that I was calling them about, and they said the appropriate notice per the insurance policy had been given to the homeowner, and there was really no, had they suddenly just dropped coverage or changed the rate in the agreed upon time frame, then there would have been action that could have been taken. But these are businesses setting rates based on their preferences and their business model. What I do not know is whether there is a legislative role for setting up a framework for providing the lane that we expect insurance carriers offering these policies in the state would operate in. So I think that one needs a larger coalition of stakeholders at the table to investigate whether there are any strategies that can help the home-based provider community. But it is a definite trend that we're seeing by major insurance carriers nationwide. With regard to the question around the cost of compliance with the fire safety code and other types of rules and regs, we have had opportunities over the last 5 years to provide one-time grant funding that was specifically designed to address those needs, but that is not something that we have on the list of allowable criteria in the RFP for the early childhood block grant specifically. And it's because of the requirement that, we comply with to evaluate these funds and their impact on families and our communities. The opportunity to access grant funding that can be used for structural improvements is rare. There are very few government funders that allow that use. And I would say even in the private foundation community, capital improvement projects are generally not the norm. We took a very unusual circumstance, the COVID relief funding, that had several branches that actually encouraged that kind of improvement to property because of the types of improvements that could help mitigate the conditions the health pandemic created. So I would say that's a work in progress.
I believe we have an additional bit of info.
Yeah, I was going to add, this is Derek with KDHE. So I think Senator Blue, maybe to add to your question and Melissa's answer, I think the nice thing about the child care health and safety grants, the 1.3 million in state general funds, was that did come with flexibility and allowed the agency to determine what those parameters were. And that's also why we were intent on tracking the provider type. So when you saw, or when you see the 81% of the funds went to home providers, that was with intent, because we know a lot of funding is geared more towards your centers, your larger providers. And so we wanted to make sure that our family child care homes had opportunity to apply for that. I'd have to go back and look. We tracked, what they were requesting. Off the top of my head, I don't remember fire systems coming up. Of course, that would be not required for our homes. The other thing I'll mention on the compliance and insurance issues, a couple things there. What we hear most often in the regulatory space is insurance carriers will either hear or find out that a provider is licensed to care for a certain number. They attach, you try to use my insurance terms here, they'll attach a rider to the policy that says, yeah, you can be a provider, but you can only have 6 kids. And so sometimes they don't outright drop the provider, but they will put a limitation on the coverage itself to say, you can only have 8 occupants in the home, or what have you, in terms of insurance language. The other piece too is we know that carriers are utilizing, we are required by federal rule and law to publicly post compliance checks for providers across the state. And so if you go search for a provider, you'll be able to pull up their compliance histories, their annual inspections, complaints, whatever it may be. And we have to post those to be in compliance with the feds. And carriers are utilizing the compliance issues from providers to drop providers. So it's not the state's regulatory issue so much as it is kind of using that against providers, unfortunately. So that's my experience with some of these issues. Thank you.
Thank you, Derek. I'm assuming that answers your question, Senator Blue. Is she still on?
Yeah. Yes, and I am so close. I'll see you guys soon.
We're looking forward to it. Be safe. Okay, Tabitha had a question.
Okay, Owen and CPPPR, did I add a lot of P's into that? I think I did. There are a few. Just thank you so much. Like the way that you guys measure and share data for us is so important to the work that we do in the early childhood field and in helping families. And that is not easy. As a person who has a front row seat to a lot of these programs, I'm just so thankful for the accountability and the commitment to excellence that systems provide in communities. And I was especially impressed with the statistic about how 100% of them are engaging families. So they are looking at what's best for families and what families want and valuing their voice. That is so important. But I do have a question about one, just some clarification for me, and you might not have this answer, and that's okay. For the early childhood block grant, one of the data points you gave us was that 88% of parents are enrolled or engaged in positive parenting practices. And I'm just curious how that's measured. Do you know that? And if not, can you get that information to me? Just curiosity.
I will tell you that we could absolutely get that information to you,
Yeah.
and you will probably be hearing quite a bit about it at the
Okay.
next cabinet meeting as well. I know that we've got Dr. Lynn Schrefferman from WSU in the back here, and she is the one that does, well, and her team do a great job of putting all that information together. But yes, there is it's part of the common measures, so it's a unique measure to parenting, and it's one that is used for each ECPG grantee for where it's appropriate.
Well, thank you. Changing parenting is so important to sustainability. And so I'm thankful for that. And I look forward to hearing more.
Thank you, Tabitha. Great question. Anything else? I had one question for clarification. Page 12, the point and count Dolly Parton enrollment, is that 2025?
It is.
It
You
is,
caught
okay,
me.
because
Yeah. So yeah,
thank
that's
you.
a mistype there. That should be 2025 at the bottom there, June of 2025.
Okay, just making sure. Okay, thank you. Because I just submitted a ton of grants that said a higher number, 78,000, like too. I'm
Yep.
like cringing. Okay, thank you.
Yep. And in fact,
Very good.
Melissa had actually asked me to make sure that we talked about that, and then I came up with the wrong date. I apologize.
Nope, that's great. Just making sure I was being honest. Okay. Thank you guys so
Yeah.
much. Okay. Thank you, Owen. Great presentation. Nothing else? There's no action on this item, so we will move on to the next agenda.
Thank you very much.
Thank you. Okay. Um, Melissa Rooker, the Executive Director of the Kansas Children's Cabinet, is going to present the Children's Initiative Fund budget recommendations for 2028. This is an action item, so we will be taking a vote after her presentation. Melissa.
Thank you so much. So that snapshot and review of the way the overall CIF budget is utilized is one piece of our statutory charge. The other is to make recommendations around the use of the funding that is called the Children's Initiative Fund. So just as a quick reminder, the funding is derived from the state annuity, the annual settlement payment from the Master Tobacco Agreement that was reached in 1999. At the time, the state legislature created a framework with the Kansas Endowment for Youth was established. It transformed what was created in 1980 and known as the Children and Family Trust Fund. Kansas was the first state in the nation to create a trust fund for children. And in 1999, we became the first state in the nation to create a children's cabinet. So we've led the way. We have really focused on supporting children and their families in this critical developmental phase of life to make sure that families have access to the services they need to the best of our abilities with the funding that we receive annually in the tobacco settlement. The packet that you received gives a little background about the annual payout that we received this year at the end of April. So after the legislative cycle, and I believe I'm not sure the consensus revenue estimating group had this number or not, but within that same time frame, we found out that this year's calendar year 26 annuity is 44,715,000 and change. That is down from last year when it was roughly 47 million. And so we are in a trend line that is trending down, which was expected from the beginning. It was the thought process around creating the endowment as the receptacle to house the corpus and ultimately spin off interest income that would be sufficient to support the Children's Initiative Fund budget. Reality is that, a variety of factors year over year seem to have diverted the original intent. And sometimes it's been factors like the Great Recession or COVID or, various things that have had an impact on the ability to maintain the balance in the key fund. The average of the annuity, the settlement payout, it clocks in at 53 million. The high over time was just over 61 million. And that was we saw that in 2022. But national policies have been adopted and state level policy choices have followed on that address smoking as a health issue, and rightfully so. This is always the uncomfortable thing, that we are funded by the number of people who purchase combustible tobacco products. Those cigarettes, I assume cigars and pipe smokers maybe contribute a little bit, but as we adopt, things like the National Tobacco 21 policy, I think that was the big shift in the last 5 years, was seeing the positive impact on the reduction in the number of people who are smokers. That's good for health. It's not good for our bottom line, and so we've seen this downward trend. In preparing for this presentation today, it really struck me that our budget high in state fiscal year 25, we clocked in at $61 million. Today, the budget that we are asking you to entertain is right just around 41.5 million. So we have done, there has been a group effort, a team effort to help us reduce the cost of the Children's Initiative Fund, because we do not have any balance in the key fund. With this year's FY27 budget enactment, there was heavy lifting done. You can see on the screen, there was movement to rearrange line items in the CIF that had historically, once adopted, they were for programs the cabinet was not the direct administrator of. So programs transferred, funding transferred to Department for Children and Families, the Kansas Department of Education, Kansas Department of Health and Environment. This year's budget, and we appreciate the work that went into this legislatively, with the support of the governor's office as well, to streamline this budget so that we are with the movement of the programs under the umbrella of the Office of Early Childhood, it really has given us a cleaner budget that will have opportunity for us to do more of the deeper analysis of the impact and the relationship these programs have, the navigation of the array of opportunities available to families. It will allow us to find ways to leverage these resources even more than programs already do. There is one outlier program that still transfers to our friends at KDHE, and that is the infant and toddler program. Part C services, colloquially known for years as Tiny K. I think there's been rebranding, but super important services for the developmental health of our youngest Kansans. But now this becomes sort of an outlier in that it is the one item for FY27 still transferring away from the Office of Early Childhood, where the cabinet will move officially July 1, to a partner agency. But with the work done, there's been movement to make sure that we are able to begin to bring down the costs of running the Children's Initiative Fund. We've done our own internal work to reduce our budget footprint on the CIF over the last 3 years. The cabinet has changed up our approach. We have reduced, last year we shed 1 FTE. I think we will see movement under the new office to further find some cost savings in terms of our salary for admin purposes. We gave up our discretionary line item, the infrastructure line item. It was high value to helping fund one-time efforts. But last year, in an effort to help reduce the size of the CIF budget, we made a recommendation to delete that line item. So this FY26 year is the last year that item exists in our budget, and we have made a concerted effort to minimize the draw against that line item to help us. The $5.8 million line item for the infant and toddler program has a special budget proviso. I trust our lawmaker friends recognize that during the budget process, it was revealed that the total amount of resources available between the existing balance in the key fund and the annuity could not sustain the budget, including the total 5.8. So there's a proviso that stipulates the CIF funding will be the first dollars used for that. And then any additional resources that are needed because we have a shortfall will be covered by the state general fund. That was initiated to ensure that the program is funded, that all of our programs are fully funded, and to help buy some time to figure out an alternative approach to things. So what you see on screen includes our FY 2028 budget recommendation. And I want to talk about process first. We will this is a recommendation reflecting the will of the Children's Cabinet Board in keeping with statutory responsibilities. That recommendation will be transmitted to the Director of the Office of Early Childhood for use in the development of the overall budget for the office for FY 2028. Agencies are required to submit their budgets by September 15th annually. So the timing of this is to give some runway for the new agency to really do that deep dive and take a look at the overall programming and budgetary needs. So the slate that you see on screen recommends another year of flat funding for the array of services that will operate in the Office of Early Childhood. The recommendation is because the proviso will effectively leave us with a $0 ending balance in the key fund, we had to reduce the size of our budget rec. And so we are not prescribing the source of funding for the 5.8 million, but this slate recommends finding an alternative way to support the infant and toddlers program, just due to the lack of budget capacity in the CIF and the key fund universe. So that is the extent of my prepared remarks, but I would be happy to stand for questions before you entertain action on this.
Questions? Suzanne, sorry. Yes. Those buttons are hard, aren't they?
Thank you for the information. So can you remind me, the infant and toddler program, does that have a federal match to our state dollars?
Yeah, this 5.8 million is the maintenance of effort. KDHE might weigh in on whether this is the complete cost. I don't believe it is, but we do have an obligation for maintenance of effort in this program.
We don't have the number here on total funds that. Yeah. Okay. Thank you.
Okay. Very good. Will you get that and report back to us? Is that okay? Very good. Thank you for that. Any other questions? Yes, Lori.
Okay, so being the new person, can you tell me where the difference, if the payout this year was 44 million and we have an approved budget for fiscal year 27, and that is 2.5 million less than, where do those dollars come from before you project forward?
The ending balance in the key fund.
Okay.
So that provides that cushion. There's also it's a timing issue as well. So, but the key fund has it needs an ending balance to provide that safety net at the end of the day. But
and so then this budget that is being recommended because there's nothing at year end in the key fund would not have that same assurance moving forward.
Correct. There's also, I should note, we do not have responsibility for determining the use of the key fund. Statute says the key fund will receive the annuity, and the key fund will the transfer to fund the Children's Initiative Fund will come out of the key fund. There are other transfers that are baked into the budget process through budget proviso that says notwithstanding KSA 38, whatever it is, this transfer will be made. So there are 3 line item transfers that come directly out of the key fund before we have resources for the CIF. It's a new one added this year, the tobacco prevention, the smoking prevention program. The reason that one is zeroed out in FY27 is it becomes a line item that transfers directly from the key fund to KDHE. The Attorney General's office is receiving $400,000 annually, and the Department of Revenue, Kansas Department of Revenue, is receiving $1.2 million annually. So before this board has any decisions in front of it to make about use of CIF funding, there is roughly 2.6 million that is used from the annuity for other purposes.
Great question. Any others? Yes, Senator Sykes.
Thank you. And so Melissa's comment brought another question. So thank you for trying to bring down our budget. And I am all for healthy Kansans, but I also know tobacco companies are very smart in trying to shift from combustibles to e-cigarettes and all of that, which I feel like we should be getting our share of that. So with that 2.6 million, as someone who looks at probably your requirements of the job that you are revenue, I feel like they should be doing that without receiving those funds from us, because I think that is part of their duty in that office. Maybe I'm crossing a line, but I just want to say, I think there are times that we are shifting money and paying for things that are not necessarily things that we should be paying for. I think that is something that they should be doing because of their job in revenue or the Attorney General's office. So I just want to be on the record, because we are taking those dollars, $2.6 million, away from investing in our most valuable resource in the state, our children.
Thank you for that comment. I mean, they're recent changes, right, Melissa?
The-
During COVID, right? No?
They were 2014, 2015 era when
Oh,
the
so
state
before.
budget was so far
Oh, yeah.
underwater. The key fund was tapped to help. The justification is that those are funding the function of tracking the sale of cigarettes, which feeds the report that has to be conveyed to comply with the settlement agreement. To your point, I cannot opine, but I can share, I can inform. Those are functions that would be happening anyway because of the sale of cigarettes that is taxed. So the Department of Revenue has to track the sale for tax purposes. The Attorney General's office does function as the compliance arm. The AG goes after vendors who are not charging the appropriate sales tax. So that is the rationale provided as the basis for using these funds to fund those pieces of those agency operations.
Yes, Suzanne, Representative Weichel.
Thank you. And just to clarify, prior to 2014, 2015, when these shifts were made, so the key fund had been around for what, 15 plus years? These transfers were not being made and those agencies were doing this work out of their agency budgets.
Correct.
Yeah, thank you. So for those that serve in the legislature, maybe it would be appropriate for discussions about this as you work through how budgets work. And if the services were going to be provided anyway, maybe this could be spent on children and families. It'd be something we would love to have you speak about. Any other questions or comments about this? But Senator Blue, thank you.
Thank you, Madam Chair. Melissa, this is my first first year on this committee, on this cabinet. So I'm trying to fully understand because when we are doing, I'm getting more information here than I do in the legislative budget hearing. So I just see a line item in the legislative budget, but here you have it broken out even more. So my question is, this $41 million is 100% tobacco settlement money?
Yes.
So no SGF, no other funds are coming in. So my question on that though is realistically, if you are having a budget deficit somewhere else, would you not just pull from the CIF grant money to make that work out?
I mean, that would be the only avenue that we have to make the bottom line work. I have thoughts about the pros and cons of that, but that would be the only discretionary item because that 23 million is used as a source of grant funding. This board every April receives the slate for consideration. The other items are appropriations. So those line items are appropriated amounts we have no control over
So,
here.
so to follow up on that, when we first started Dolly Parton Imagination Library, was that a SGF to get started, or how did it get into the budget?
Thank you for that question. It was championed by Representative Waymaster. The first year we had, we wrote a line, we sought permission in our preschool development grant to expend 350,000 to get it off the ground. In subsequent years, we've had the $1.5 million CIF line item. So it has never had any state general fund funding. It is funded in part through the Children's Initiative Fund appropriation. We have a network of local partners. They're nonprofit organizations arrayed across the state who support 50% of the cost of the program. And Owen gave you a teaser. We have achieved nonprofit status for the Dolly Parton's Imagination Library of Kansas 501c3, and fundraising is rapidly developing for that entity now that we have the proper tax designation, because the vision is to create a private source of funding to shoulder a share of the cost. So ultimately, if we could get to a model that is basically a tri-share where we maintain some level of CIF funding, but we're, this is the limit of what we're going to be able to afford, maintain the local partnerships so that we have the buy-in from local communities, and then have this private entity dedicated to supporting the program. I think we can get to a place where each entity is basically handling a third of the cost would be our long-range vision for adding the nonprofit state level.
And then a follow-up on that, and this is just projections. We're projecting that we're going to get 41.7 million in 2028.
Yeah. So the consensus revenue estimating group in April set their estimate. I believe it's 42.5 million. So they increased it from the November estimate, which fell as low as 39 million. So it's slightly increased, which is helpful. That what the trend they're seeing in tobacco sales is that the annuity, it sort of is settling at that amount, but still we are striving to live within our means.
I guess that's just my other question is, what if everybody who utilizes tobacco products woke up tomorrow and said, I am going to quit?
Then we're out of business.
Yeah, or they shift to e-cigarettes, so that was just my question of, we're proposing something that is, and I get the whole process, I get the legislative process, but and how we have our fiscal years, but it's just it's one that it does always worry me on. We are projecting in the future, and there's no way to know. Same with the legislative budget. There's no way to know if something horrible is going to happen. So I just wanted to make sure that I was understanding everything correctly. Thank you.
You are. Great job. And we're glad to have you as a part of this. And it's nice to meet you in person the first time. Yes, Senator Erickson.
Thank you, Madam Chair. What would be helpful to me is to know in context, because we're not the only group that provides any kinds of funding or programs or services. I did a quick AI search, and it would be helpful to me in context of the budget to know what other programs are out there and what they're funding. We talked a little bit about the Hanson and Patterson Family Foundation, but AI is telling me that the Office of Early Childhood has a budget of 225 million. The governor's administration has secured over 469 million in additional federal, state, and private funding. State pre-K has over 115 million, and then we have our tobacco settlement. Those are the funding that is listed as for pre-K and early childhood programs. So it would be nice to know statewide, what programs are there? Who's funding them? What's their role to make sure that our funding is going to meet those unique needs that aren't being met anywhere else?
Appreciate the question. We can definitely bring clarity to that. Not live in this moment, but I can put some context around some of those numbers that you just quoted. The federal figure of over $400 million is actually the amount that the state received in COVID relief funding over spendable over a 5-year period. The bulk of it was an increase to the child care subsidy program, but we have also found some creative ways to use other strands of COVID relief funds. Our capital projects funding is ARPA money that is creating 10 community center hubs for families across the state. The Spark funding, as we named it, the nickname that we gave it in Kansas, the ARPA State Fiscal Recovery Fund dollars were used for the Child Care Capacity Accelerator. So that 400 million is separate from the budget, that number that you quoted for the Office of Early Childhood. I won't get into whether that is precise or not, but I will say the Child Care Subsidy Program, it's known federally as the Child Care Development Block Grant Fund, is the next largest source of funding that states receive. So that is our Kansas share, makes up the basis of the Kansas Office of Early Childhood budget. It supports both the child care subsidy program and child care licensing, as well as efforts to improve the quality for child care. So that's professional development offerings and other supports for child care providers. Beyond that, those numbers include the probably certain McVie federal funds. There's a number of different federal programs. So we can dig into more of a picture, a well-rounded picture. It will be, again, I'm super excited for July 1st when we actually merge and begin to have a team that can come together and bring these kinds of metrics forward and make it easier to report back to all of you in multiple settings.
Great. Thank you. Other questions? Representative Christy Williams.
Thank you. And I want to thank Deputy Director Bricker for your hard work. And I wanted to preface this before we continued on with the budget and just briefly why I won't be able to support the budget. It's not because of your excellent work, because I do believe that you've done far and above. But overall, the funding structure really leans itself towards institutions and dependence on those institutions. And I see the same entities, whether it's a K-12 preschool or another daycare center getting the money. And I would rather it be parent directed. And so I also have concerns about just the whole lessening of income. And I appreciate the CIF has reduced and the legislature lack of input on those CIF grants and the concern about the neutrality of the delivery type for those CIF grants. So even though I appreciate all the hard work, I just wanted to let you know an explanation of why I won't be able to ultimately support the budget. Thank you.
Thank you. Anything else? Seeing none, seeing no questions, I would entertain a motion to approve the CIF funding recommendations as presented.
I move that we approve the budget as presented.
Thank you. I have a motion by Tabitha, second by Representative Laura Williams. Roll call vote. Let's do that. Okay. David Younger,
Aye.
Representative Christy Williams,
No.
Representative Laura Williams,
Aye.
Representative Suzanne Weigel, Representative I'm sorry, I got in a rhythm there. Dr. Tara Wallace,
Yes.
Senator Dinah Sykes,
Yes.
Tabitha Rossbroy,
Yes.
Senator Renee Erickson,
No.
Senator Tori Marie Blue.
Can I pass? Is that allowed?
Sure.
Pass. It's just my first budget and I want to learn more.
Lori Blake
Yes.
and Dr. Leetta Felter, I vote yes. Thank you. Motion passes. All righty. You. Again, I've got the ear thing today, surgery in a week and a half. Melissa is going to present the Early Childhood Advisory Council. It's a slate that we will be voting on after her presentation.
Thank you, Madam Chair. So we don't have to belabor this one. This is an annual action the board takes in 2020, the governor issued Executive Order 2002, naming the Kansas Children's Cabinet and Trust Fund to serve as the official Kansas Early Childhood Advisory Council in compliance with federal Head Start regulations. That executive order set up the structure that created the Early Childhood Recommendations Panel so that it serves as a standing committee of the Children's Cabinet in order to incorporate the subject matter experts and the particular program representation that the federal law lays out. We do not possess those roles among the voting members of this cabinet board. So the slate package was developed through a public application process that we run every spring. Application opens in April, we close it in May, and review to make sure that we have all of the roles on the recommendations panel populated by the representatives that serve in the appropriate roles. So the slate you have in front of you is roughly half of these folks have served in the past and are interested in continuing to serve, and half of them are new people who stepped up and submitted applications that we love seeing. There's the business community is represented, and as well as all of the agencies and the external partners that should be at this table. The panel meets monthly under its current structure, and the term of office of service on this panel follows the state fiscal year pattern. So we approve this slate, and these folks will begin serving July 1st, and their term will wrap up June 30th next year. If there are questions, I would entertain them, but that is the basis of this, is just to repopulate for next year.
Questions? Lori has a question.
And looking at the slate of representatives, it was an application process. How did school districts promote that information? Just seeing that the two representatives of local school districts are both from the northeastern region of the state.
So we use every communication channel that we have to publicize this opportunity. I know our partners help put it in their listservs and public communication networks. So all of the various partners help us promote the opportunity. We put it in our weekly All In for Kansas Kids newsletter. We promote it on our website, in our monthly webinars. There's and social media to the extent that that's utilized.
Okay, thank you.
Are we assuming those are the only two from public school districts that apply? Do you know?
No, we did end up with more applicants than we had room on the panel, and we try and balance representation so that we don't have a heavy concentration in one subject area. We do try and have geographic range on the panel as a whole. Yeah.
Okay. Yeah, I've noticed historically, I haven't seen just from Johnson County for the public school districts, so that was interesting. Any other questions or comments? Yes, Senator Blue.
Thank you, Madam Chair. Melissa, my question, and you've heard this from me in the legislature 100 times. You're going to hear it now. Who here is from Western Kansas?
I'm going to phone a friend.
And I'm going to count, by the way, because everybody, yeah, I see Molly's on here, but I'm going to say Western Kansas is west of Salina because that seems to be an issue for some folks.
Senator Blue, I appreciate that. I do agree. We don't always have as many applicants from that region. We do try and geography is a key factor in all of the slates that we put together, whether it's grant funding or something like this where it's membership and participation. So I would put out a pitch that if you know people who are interested in serving, this is not the only way people can connect to the state early childhood ecosystem. There are a number of different organizations, committees, governance groups that support the ecosystem, and lots of ways people can get engaged. So if there is a recommendation for how we could be better communicating, we are always open to that and do our best to make sure people know their participation is welcome.
Thank you. We never want a blind spot, and having representation is important. This is a one-year appointment, and so perhaps the next one can better have a spread of representation. Anything else? Seeing no other questions, I would entertain a motion to approve the recommendations for the Kansas Early Childhood Advisory Council. And I will do a roll call. David Younger. Oh, I need a motion. Sorry. I'm really trying to expedite. Can you see my timer? I need a motion.
I will
I'm like,
I will
hurry.
make a motion to approve this.
Motion, I have a motion by Senator Sykes. I'll take a second. Representative Weigel. Okay, David Younger.
Aye.
Okay, thank you. Representative Christy Williams.
Aye.
Representative Laura Williams.
Aye.
Representative Suzanne Weigel.
Aye.
Dr. Tara Wallace. Senator Dinah Sykes.
Aye.
Tabitha Rossroy.
Aye.
Senator Renee Erickson.
Aye.
Senator Tori Marie Blue.
Aye.
Lori Blake.
Aye.
And aye for Dr. Leetta Felter. Very good. Okay, we're going to move next to agency updates. We have amazing agency partners. And today, since we're trying to expedite, as you can tell, things, I am going to ask our wonderful agency partners if you can present your highlights in 3 minutes. And then if you're not able to get everything, will you send the information to Dioga and she will disseminate it among us? Does that sound like a good plan? And this is not going to buzz or anything. This is a great little timer. I'm going to push play because ADHD, I tend to go down a rabbit hole if I don't stick to notes or timers. And so, Christy, we will start with you.
Thank you.
You're
I will
welcome.
beat the 3 minutes because you will
Okay.
hear from me this afternoon. All kidding aside, we are on track for the office to be operational no later than July 1st. We have 3 move-in dates for staff. They're busy packing their boxes as we speak, going through their personal belongings. And those 3 dates will be starting next week and then the following week. So we're on target with that. I also just wanted to talk a little bit about the business tax credits that you made a comment on, because I think that that is a really important piece. It goes back into communication in general. And you will know pretty soon that there are some community partners who are working with some business folks that are crafting the best message to get those tax credits that are out. In addition to the resource and referral program for families, will also have the ability to where families are able to receive supports direct from their employer, automatically paid as if it were an employee benefit. So we're excited about that as well. Other than that, I'm going to stop there and pass it on to the next agency because you'll hear some more about programming later.
Oh, I'm so impressed. Time left over. Thank you. Okay. Craig.
All right. Good morning, all. Craig Barnes, Assistant Director, Kansas Children's Cabinet Trust Fund. I will also beat the 3 minutes, but I also had a heads up before, so I prepped for that. 3 quick updates. First off, for early childhood block grant, based off the board approval from our April meeting, grants have been set up. We're finalizing the logistics for that to have a successful launch of the new grant term starting July 1. Excited on 2 fronts. One, I want to first off give a big appreciation to the rest of the Kansas Children's Cabinet staff. They have, with their due diligence in a time of transition to the Office of Early Childhood, kept us above and ahead of schedule with this from our normal operating procedures. So a big thank you to them. They deserve all the credit for the successful launch coming into July 1. And excited on the second part of that because it'll be our first grant process that is new, starting with the new Office of Early Childhood. So we are excited for that endeavor. CBCAP, again, based on your recommendation and approval from our last board meeting, we entered into renewal applications. So excited to announce that those renewal applications launched yesterday in our Kansas Common app for those grantees. So they are starting the process of completing those renewal applications, and those will be due by July 1st, and then we'll start with the federal fiscal year. So excited for that as well. We will have office hours for those grantees next week, and so we're excited to have them on a call and talk through the logistics of that. And then lastly, just piggybacking off of Christy's update, just excited for the Children's Cabinet to transition into the new Office of Early Childhood. So we are finalizing a lot of the year-end logistics to make sure that we have a successful launch for that, and ensuring that we have no service disruptions for any of our grant portfolio and grantees. A lot of communications with grantees. So thank you to our grantees who are listening for all the phone calls and virtual calls that they've had with me over the last 6 to 8 weeks getting ready to launch this. So open for any questions that you all may have.
Any questions? Thank you for that update, Craig. Are you enjoying your job?
Loving my job.
Enjoying having you.
Also not going to say anything different.
We're enjoying having you. Amanda Peterson.
Good morning, friends. I'm Amanda Peterson, Kansas State Department of Education. Our communications team does a really incredible job, so I'd recommend going to our website, ksde.gov, and at the top of the webpage, you can find a news center. There, if you're not already, you can subscribe to KSDE Weekly, which is our weekly newsletter. I'll put out a plug. It's a wonderful way to share information with school systems around the state, and we're always glad to do that. You can also find highlights about what's happening in Kansas schools and previews of state board meetings or recaps of state board meetings. There's also a monthly podcast. The May podcast is outgoing Commissioner Dr. Randy Watson, interviewing incoming Commissioner Dr. Jake Steele. So if you'd like to get to know our incoming Commissioner a little bit better and have 45 minutes, it was a really lovely conversation. And I'd also recommend that you tune into the state board meeting next week, Tuesday morning, for the Commissioner's update. That will be a good opportunity to be able to hear from Dr. Steele about his vision and some of our work moving forward. In May, the Kansas State Board of Education approved the Kansas Preschool Pilot slate of grants, which, moving forward, as a reminder, are funded entirely by temporary assistance for needy families. So we're not going to be seeing them as part of the Children's Initiatives Fund portfolio in the future. And the state board also approved our slate of school districts to operate approved preschool age at risk programs for the coming year, which is part of the state school finance formula. And then the last piece that you can find on the website is a news release from May that begins to explain some restructuring that our agency is doing. You've heard me speak quite a bit about our work related to school improvement, and I'm very excited that as part of Dr. Steele's work to continue moving that work forward, the state board in May approved or named Dr. Zach Conrad as our new Deputy Commissioner of Accountability and Technology. Being able to have both clear roles and responsibilities around accountability and supports, I think, is really going to help us continue supporting schools to be able to deliver really excellent education for students. So again, tune in on Tuesday morning if you'd like to hear more about the rationale for that. And then I will note that on a personal note, as our agency restructures in some ways, that also has some implications for me. I'm going to be stepping into a new role at the agency as Chief of Staff on Monday, actually. So you'll continue seeing me. I'm going to continue being responsible for the early childhood policy and leadership for the foreseeable future. Although for the next couple of months, you're going to be seeing quite a bit more of Natalie McLean, our fabulous preschool programming coordinator, between travel and some other life things. She's going to be serving as our designee through probably December. So
Congratulations on the shifting role, and you'll be amazing. Thank you. Thanks for that update. And Derek, what do you have for us?
Yeah, 3 minutes for a guy that loves to talk is really difficult.
We'd
Hi.
love to hear you talk, but
Well, don't press start yet. Yep,
okay, well,
I'll wait.
we've got to press start. We've got a flight to catch.
I will honor the time. Yeah, I'll try to be quicker. Hi everybody. I'm Derek Flurlog. I'm now the Deputy Director for Public Health at KDHE. Amy is our Director for the Bureau of Family Health, and so going to mention on her behalf that our Title V Maternal Child Health Block Grant application's posted. If you go to kansasmch.org, you can find the proposed application. We break that down into the different domain areas and the narratives and measures, and that survey closes on June 23rd. And then our newborn screening program, which is very robust, we've officially added 2 new conditions as a part of that universal screening. So exciting stuff there. On my end of things, childcare regulations are well underway. So we have published in the Kansas Register on May 14th. We have our JCAR discussion and hearing on June 23rd, and then our public hearing, which is going to be at the Curtis State Office Building. And I can send this info, of course it's in the register, I can send this info to anybody, is on July 13th. That again is kind of 2 purposes for those regulation proposals. House Bill 2045, of course, compliance package for some of the regulations that we need to meet, dictated by the legislation, and then out of school time programs, which we are bringing them up to speed in terms of alignment with federal subsidy requirements. And so that's been a big ask from those programs over the last few years, as they want access to subsidy dollars. So that's huge. As far as WIC, the only thing I'll put on everyone's radar is the federal remote waiver, which allows us to do essentially telehealth for WIC applicants, expires at the end of September. That is at this point not going through the federal pieces that it needs to. I think it's worked into the Farm Bill, and I'm not quite sure of the status there. So we're trying to get an update. We do have a very supportive federal delegation for WIC. So otherwise, WIC clients will have to come in person, and that presents quite a bit of barriers in terms of transportation. OEC, of course, as everyone has mentioned, I will be staying at KDHE, by the way, but we're in the early childhood game in many other ways. So speaking of which, working on a lot of exciting initiatives with rural health transformation. We just sent out, $80 million, I believe, for rural emergency hospital conversion, capital improvements, and regional partnerships. And we currently have an application live for community health workers and accountable food as medicine, which is really exciting. It's using food as an actual prescribed health intervention. And with that, I'm done.
Good job.
And of course, open for any questions, but you have my email, so.
Any questions? All right. And Brandy Wells is not here, but I believe Melissa has her update.
What Brandy conveyed to us that the Board of Regents will be naming their new president. Is that Blake's title? CEO. Um, Actually, did she say at their June meeting to start July? Okay, thank you. Sorry, I did not have that in front of me, but we do know that the Blueprint for Literacy Task Force is based at Board of Regents. I don't have any updates, but I know they've been hard at work. I know the legislature had some adjustments to the blueprint this year that hopefully will help spur the work and keep things moving on that front.
Great. Thank you, guys. That helped, didn't it? If you have anything more that you want to share, please send it to Dioga, and we would love to hear it as well. We have our director's update next. Do you want me to put a timer for you?
I will keep this brief. Craig addressed the basic business that's going on at the cabinet. We are winding down. We're in the final quarter or so of most of the federal projects, and this is tricky this year. The state fiscal year closeout process has its own set of challenges annually, and we are also picking up and moving both physically and technically in terms of where funding resides. So that switch will get flipped overnight from June 30th to July 1st, but the cabinet itself will physically be based around the corner in this beautiful building starting in another week or so. We've got our moving date. We are all working out of boxes at the moment in our existing office space and working to make that transition go smoothly on the day. So we are really excited about that opportunity. For us, it's a move across the campus. We are currently in the Landon State Office Building with our partners our current partners at the Kansas State Department of Education, where our team has worked under a memorandum of understanding for the last decade. I just want to use my time today to say thank you publicly for the support and teamwork that we have enjoyed with our friends at KSDE. It's definitely been a fruitful partnership. We have appreciated it very much. There's a lot of overlap. There will be continued opportunity for collaboration because of the programming offered through the system itself that KSD supports. But I am excited on behalf of our team to join an agency and be part of be actually part of the agency and not this weird little tacked on. We have this piece of paper that says these functions will happen. It's going to be a game changer for the Children's Cabinet and reflects work that we identified through the Preschool Development Grant that was awarded to Kansas in 2019. The original comprehensive statewide needs assessment identified as one of the 7 most pressing needs in the state was improving navigation of our system for children and families. And this is the realization of a lot of years of hard work among a wide range of stakeholders, both inside state government and outside in the provider community. And we are excited about the opportunities this presents for children and families and the provider community. So there is a wealth of exciting times ahead. You will be receiving communication about the July 1st opening as board members. So stay tuned for that. That will officially happen July 1st. And when our business meetings have adjourned, we're going to walk around the corner and tour our new space. So I will just leave it with a note of gratitude for everything that has led to where we find ourselves today.
That's great. Exciting things to come. Any questions for Melissa? Senator Sykes.
No questions, but I think it is exciting. So as someone was here when we first got that grant from the National Governors Association, and part of that with technical assistance, and then being off the cabinet for several years, but it's really excited to see the fruition and the work that was put in. And I remember when we had a wall looking at where all of the funding was. So I think it's very excited and it's a great day for Kansas.
Yeah, Kansas kids. Anything else? Okay. Before we move on, I'd ask just for a little latitude to add an agenda item. Let's just call it chair comments. And with your blessing, I'd love to talk about potentially forming a work group. Considering our new statutory framework, there's the potential for a lot of churn. And I just think it would be great to put together a work group that could come up with best practices, governance structure, as far as like we noticed when Dawn had to resign, suddenly we were kind of had no one at the helm. If we had a vice chair, it would easily, seamlessly have someone that could pick up. Um, as we pass the batons, as we will have, I would assume this would include a manual and, all of the documentation that would provide future children's cabinets what they need to carry our mission forth. So when we aren't in these roles and someone else is, they have what they need to equip them to be successful. It's just kind of guardrails for us to not derail if there's a lot of churn, which there very well could be, very quickly and frequently. And so I'm thinking things like, what do meetings look like? Do we have a chair and a vice chair and a chair? And how regularly do we meet? Those kinds of things. Would anybody support that? Any comments about it? Yes, Representative Laura Williams.
Thank you. Serving as on our Rules Committee in the House, I just had a question when it comes to how the meetings are already governed. Is there precedent where you follow Masons, you follow, Roberts? Sorry, we follow Masons in the House. So is there precedent? Because I know how our committees are set up. There are committee rules and there are documents for us to govern ourselves.
It makes it better. And go ahead, Melissa.
I would just point out Dr. Felter's doctoral dissertation is on effective board governance. So she's recommending that we do the work to put some of those best practices. We don't have a manual that lays it out. So we defer to Robert's rules when there's a question, but it could be very helpful. Board members used to have a 4-year term of appointment, and now every one of you serves at the pleasure of the appointing party. And, that's fantastic until there's an election cycle and there are changes in who has the appointment to make. And no matter how dedicated you are in your role here, it is the prerogative of the people in those leadership roles to make changes. So I think some continuity of governance and operations would be helpful. So I appreciated this recommendation.
Thank you.
Yeah, I just had a quick question on that. Is that guided through statutory guidance or with the appointees and how it has changed? Was there a change in 2014, 2015 on that?
House Bill 2045 changed.
Oh,
There were amendments to board makeup. 2 new seats were added for legislative appointments, and the shift from the specified 4-year term on a staggered basis, which had been maintained from 99. So we have never in our history had the potential that we could see the entire board turnover, but that is the reality at this juncture. We've got a governor's race and no telling what the prerogative of the new governor, because it will be somebody new no matter who, right? So 5 potential new appointments, and House members are all, I don't have to tell you, everyone's up for reelection. So leadership will change. You all may be, have the blessing of choosing to continue and having leaders who agree, but the risk exists for this organization that we could see wholesale change. And that was what Dr. Felter observed with the
Yeah.
unexpected change of chair.
Yeah, being on the norms committee, don't you see how it helps stabilize and inputs guardrails on processes, and it's a gift to future cabinets and boards is more what I'm thinking. Like the most we have is this governing body. We've adopted norms and practices. And I think if we just had a committee that basically we could call it a strategic planning committee. Okay, what do we need if we were to all be on an airplane, God forbid that went down? What would the next governing body need to pick up from where we're leaving off? And, and then when we don't go down in the airplane, what do we need just to say, here's how we operate? And so I'm not asking for us to make any decisions today, other than I would ask that we form a small committee to perhaps bring, I put down a date, have a draft out maybe 2 weeks out before this August 7th meeting for everybody to review, and then we could discuss it on the August 7th agenda. Anything else?
I just didn't know if there's any more statutory changes outside of 2045. I'm familiar with that, but I didn't know if there's guidelines within the statutory requirements in the Children's Cabinet. Okay.
And just to be clear, I'm saying working within the statutory framework.
Sure.
I'm saying to facilitate that at its highest functioning level.
Yep.
Okay.
Yep. Thank you. Thank you for the clarification.
Senator Erickson had flagged me, and then I'll come to you, Senator Blue.
Thank you, Madam Chair. And yes, I think it's a good idea. And I would like to see us move sooner rather than later just to get that in place. And and I think having a vice chair is also very beneficial. I don't know how any group operates without having that partnership, and in lieu of the president or the chair being unavailable, having someone who can step in and keep the ball rolling. So I highly support the idea, and thank you for bringing it.
Thank you, Senator Blue.
Thank you, Madam Chair. Are you looking for a motion to create a committee? With that, I move that we create a committee. What would you like to call it?
How about you want to just call it Strategic Planning Committee, something generic?
Great.
And
Creating
will
that
you
committee.
Will you create the draft to have it ready 2 weeks before the August 7th?
Exactly what you said is in my motion. And
Thank you.
and
Good.
I'm thinking a member of 3 members. That way
That's
that
great.
way there's a limit on it. And that's my motion.
That's wonderful. I have a motion by Senator Blue, a second by Renee Erickson. Let's do a roll call vote. David Younger. The father of the bride might be fathering right now. Representative Christy Williams. Oh, he said yes. Okay. Representative Christy Williams, aye. Representative Laura Williams.
Aye.
Representative Suzanne Weichel.
Aye.
Dr. Tara Wallace.
Yes.
Senator Dinah Sykes.
Yes.
Tabitha Rossbroy.
Aye.
Senator Renee Erickson.
Aye.
Senator Tori Marie Blue.
Aye.
Lori Blake.
Aye.
And yes, for Dr. Leetta Felter. Fantastic. Now for the 3, I'm looking at you, Representative Laura Williams. Would you be willing, since you currently serve on a similar committee? I nominate. No.
I did not ask all those questions to be nominated, but I'd be happy to help be a part of that.
We would welcome, I mean, just the questions you asked showed me that you have enough expertise. Does that sound good? And Renee, would you like to join as well?
No, but I would like to recommend someone.
Who would that be?
I'd like to volunteer Senator Tori Marie Blue.
Okay, I love that. Do I have a third? Anybody want to volunteer or? Do you want to, Lori?
I would be willing to. I do this work every day with school boards, so.
Fantastic.
Can I ask you a question?
Yes.
Madam Chair, I was assuming that you were going to be on it as well, since it was your
Okay.
brainchild and you have a
I would
doctorate
be,
degree in
yeah.
this.
Okay. Yeah. Do you want me to facilitate it and then have 3, or do we want to, is that all right? I'm seeing nods. Is that okay? Okay. Okay,
I amend
Do
my
we need to-
motion to be 4 instead of 3, and I'm sure my second will approve of that, and hopefully the rest of the board agrees.
okay, we have an amendment to the motion by Senator Blue to allow 4. Do I have a second? And I have a second by Senator Renee Erickson. All in favor, say aye. Aye. Okay, that passed. So we're going to have a committee of Representative Laura Williams, Senator Tori Marie Blue, Lori Blake, and Leetta Felter. Fantastic. And Dioga, will you, can we have Melissa, can we have Dioga schedule us, or how do we do that?
We will provide staff support for
Staff
sure.
support to get that scheduled. Our goal, guys, is to have just a general framework. I mean, this is not getting in the weeds. It's just high level stuff. 2 weeks prior to August 7th. I probably should have just done that date, but okay. Thank you guys for the extra time on that. Okay, so we have the next item is upcoming cabinet meetings. Our agenda says August 7th, 2025, but I think it means 2026. And it's virtual. And then beyond that, we have October 2nd and December 4th. Are those both virtual as well?
Yes.
Okay. Any questions about those? Any problems? Okay. Yes, Senator Renee Erickson.
Yes, my apologies, Madam Chair. I will not be available on the August 7th. I'll be at Kane. So
Okay.
my apologies, but I will be unavailable.
We will miss you. Okay, and so prior to adjournment, I'd like to give you guys the lay of the land for the remainder of the day. We're going to take a quick comfort break, and then I ask the cabinet to come right back. Those of you, our partners our partner agencies, you can go with our blessing and gratitude. We're going to come back and hit it hard right up for the Dolly Parton Imagination Library while we have a quorum, keeping in mind we have a flight to grab, and then have lunch, and then a tour of the offices. And Melissa, do you want to add any context to that?
No, I think that covers it. We might get up and tour the office and then do lunch, even in spite of the fact that it's here. We will do a board retreat this afternoon, and we do welcome our ex officios. You are members of the cabinet board, so I know that's a little variability in when, but we would welcome you back. And
Absolutely.
we will commit that this afternoon's retreat will not extend past 3 p.m. And if business and conversation wraps up sooner, we will get you on the road home for Friday evening purposes as soon as we can. So that's the remainder of the day.
Awesome. With that, I'd entertain a motion to adjourn. Senator Sykes, I have a motion and a second by Representative Laura Williams. All in favor? Aye. Aye. Any opposed? Okay, we are adjourned. Thank you so much.